All right. Good afternoon, everybody. Welcome to today's session, Nothing About Us Without Us, using an innovative storytelling tool for caregiver advocacy. Next slide, please. Hi, everyone. So, a few housekeeping things before we get started with our session. One, be sure to click the global interpretation icon to select your language in either English or Spanish. Click the live transcript button to enable closed captioning. Please remain muted during this session until prompted. Use the Zoom chat feature for comments and reactions. We love to see your engagement, and it'll also help our presenter move along knowing you're out there in the virtual space. Also use the Zoom Q&A to ask questions. Before we begin, I want to ground us all in our practice agreements to guide our session together. One, be present and accountable. Don't feel any pressure to speak, yet also resist the temptation to stay silent. Be brave and be inclusive. Our values, cultural identities, and personal experiences matter, and recognize that conflict is always possible and it's okay. Take space and make space. If you're someone who really loves to participate, just be mindful of that. Give us introverts a little bit of time to process, to join the conversation. And lastly, address racial bias systems and norms. Call out power dynamics. Let's recognize our personal biases and consider how they might impact actions and avoid becoming defensive when Black, Brown, or Indigenous folks speak from lived experiences. Next slide, please. It is my pleasure at this point to introduce my colleague, Sheena McKinley, who will talk and lead us through the rest of this session. So I'm turning it over to you, Sheena. Thanks, everyone.
Thank you, Steph, and thank you everyone for making time to join the conversation today. I'm really excited to just dive into discussion with everyone. So let's jump in. We're going to talk today a little bit about what the problem or the challenge that was presented that kicked off this project, what was created, and what was the process of making the thing. And then what did we learn as we tested that prototype? You heard a little bit about that in the keynote session earlier today, the process of innovation. And so what did we learn from testing the prototype? What did we change as a result of what we heard during that test? And what have we learned after public launch of this tool? So let's start with the problem. We use something that might be similar to some folks or might be a little bit new to others. And we use a format where we ask basically people the who, the what, and the why, right? And so this is used in a lot of design processes, but basically we really wanted to center on some common challenges that were coming up, right? And we were really fortunate to see so many amazing caregiver voices uplifted in the incredibly inclusive formats of Caregiver Coalition and lots of other groups that we have convened as health leads over the years. But we also knew that there were a lot of people we needed to hear from that couldn't make it, right? Either because, well, maybe a combination of these things. Their calendars were super busy, but if you've ever been there, sometimes it's the scheduling that's difficult, but also as you're doing so much for others and for yourself in life, it also makes the mental and the emotional load heavy, right? And it's hard to think about, oh my goodness, I can't add one more thing, right? And so how do we hear from busy caregivers, sometimes isolated caregivers, and we need to hear their voices. We know that they're not in the room, and we know that even if the room is made to be the most, inclusive, great space, maybe we offer different times of day or different days of the week, that by definition, really busy caregivers may not be able to join those kinds of meetings and have their voices heard in that format. So how can we really understand this problem from the caregiver standpoint of sharing their stories, wanting to share their stories, be part of the interpretation process, and how the lessons from their stories drive action, but do this without meeting dependent options. And I also want to call out that typically, as a participatory research or community-based researcher, I would not be presenting solo, right, at a session like this. I would be co-presenting with caregivers themselves. They would have been part of a participatory research team. And just calling the elephant out in the room out, I'm presenting solo. Why is that? And that has to do with the problem statement, right? Because we're asking, how do you hear from the people you're not hearing from, who aren't in the room, can't or don't want to be in the room? So how do we have almost that experience, that heart, the values of true co-design or true participatory research, if that's the challenge, right? And the fact that, they're maybe not able to be in either a co-presentation situation, but even a longer arc of like, multiple meetings or multiple hours over time. So that's part of the problem we were facing together and wanted to solve around. And when we think about a problem statement, we can also follow that through with some questions, right? So I kind of hinted at this earlier in the problem statement, but part of the question then that provoked or brought us to was this question: how might caregivers who are not reached through existing inclusive channels, so the best of what can be offered in what is working in the world, there's still people left out of that, right? How can they share their stories and drive interpretation and action on their own terms, on their own time, at a time and space and place convenient to them? And how do you hear from the people you're not hearing from? And whether you're a caregiver, care recipient, or caregiver ally in this room today, I think we can tap into that feeling, right? Moments in our life where I know for myself, I wanted my voice to be heard. I had things to share. I wanted to be part of change. And um, again, both in busyness of life, but also just in the everything that I was holding in that moment, it was the kind of season of life where it would have been almost too much or too hard. Maybe at most I could have group chatted my best friends back, right? So what is that level of simplicity and ease for someone, and even more specific in this case for caregivers who are dealing with a lot of different things springing up in their lives, to share their own stories, to be heard, to want to be heard, and to do so outside of, existing ways of doing that, which is often through meetings or surveys. And so that was a real opportunity for innovation. And then the other thing I just want to point out is this phrase or the title of the session, "Nothing About Us Without Us." And that's a really simple and straightforward way to talk about what we often hold ourselves to in participatory research or community-based research, where we want to make sure that whoever is impacted by the problem, right, in this case, caregivers, is part of the research process, the design process. And in some ways, this is a straightforward way of talking about something that some people refer to as epistemic justice, where we really are making sure that people who have been marginalized from conversations are driving, right, the changes that need to happen. They're part of the knowledge making process and the making process overall, and really acknowledged as experts of their own lives. So those were the questions that led us into the design. And I'm going to share a little bit about what we co-created and how we co-created. So a little bit about the process. There's a lot of detail here, but basically I'll just take you through some of the key steps in everything we did. So first was we convened a group of caregivers, and again, not saying that the group was representative of all the isolated caregivers, because we have to always keep in mind, who are the people we're not hearing from, right? Or what are the stories we're missing? So we knew it wasn't going to be what a lot of people think about as like this perfect representative sample, but we did want to start from somewhere that was closer to it, and to the experience. So we met with a group of caregivers and we did something called an anecdote circle, which is just a prompt, and everyone goes around in the circle and shares a story related to the prompt. So the prompt was, share a standout experience as a caregiver, a moment that stood out to you. And everyone went in a circle and we took some notes as people were sharing, and then we themed that. And from those stories and the qualitative analysis of those stories, we found there were a couple key themes, right, across very different stories. Some were family caregivers, some were more formal caregivers, and some are both, right? But we found some common themes, and those served as sort of like cultural signifiers, ways to understand caregiver stories, sort of like a code book, so to speak, right? Of how we might understand caregiver stories and how caregivers might be able to tell us what their own stories mean. And so from that, we went into a prototype process where we designed this storytelling tool, and we included the themes that came out as ways of individuals submitting their stories to be able to code their own stories. And then from there, we tested it with a group of English speaking caregivers. And automatically there were some things that needed refinement. So this was a pretty small group that we tested it with. We improved the prototype, and then we tested it with both English and Spanish speakers. And then this is, well, I'll share this a little bit later, but there was some revealing results that made us think, okay, we need to also do a test with monolingual, specifically just a test with monolingual Spanish speakers. And then after that, we improved the prototype a little bit more, and it's currently what's available to the public right now. And we've been collecting stories and having caregivers across the country interpret their own stories for the last few months. I'm happy to share more about the process later if there are questions. So as we tested the tool, we engaged 19 caregivers overall, and they ranged across the rounds in terms of being English speaking, monolingual English speaking, bilingual English Spanish speaking, and monolingual Spanish speaking. And they were from different cities and states across the country. We wanted to get to caregiver representation across geographies and also different types, formal, informal, and both, right? And everything that they shared helped us improve the tool. We had this hypothesis that the tool would take about 15 to 20 minutes. It did turn out to be true. The average was about 20, 22 minutes, which might sound long if you compare it to, I don't know, like doing a very quick customer satisfaction survey or something like that. But you have to think about this as an average of time for someone very busy, and that gives them a hint of an experience that's more like, you know, a series of participatory research meetings, which might be an hour a pop, that goes for several months, right? And so in comparison to that, you know, 20 minutes is pretty doable. And this is one of my favorite quotes that came from one of our testers. And you can see it on the screen. But, you know, basically the tester was sharing about her, this is not the story that she entered as her caregiving story, but this was more just in the study or the testing feedback. She really enjoyed it, and it helped her reflect on her life, right? And I'm going to actually share a little bit more about the power of someone having agency to think about their life, and whether it stirs up heavy and difficult emotions or really positive emotions and kind of uplifting emotions, that there is such power in not just sharing a story that's for immediate calls to action, right? That's beautiful in its own right. But there's something here where these are stories that maybe haven't been digested yet, right? They're not written for public audiences immediately. They're shared either anonymously, or they can say how they want to be credited. And as they're writing their narrative or their short story, they're doing the interpretation. They're almost like digesting that raw experience. And so that is part of the journey. It's not just about, okay, here's my story, here's what I want to do with it, or here's kind of my public testimony, right? This is a little bit part of experiences that people are interpreting as they go. And because of that, might let us hear about themes, trends, emerging issues that we don't already know about, that aren't already ready and positioned for public advocacy. Okay, so we're gonna pause and do something hopefully a little bit interactive. I know it's afternoon for many of us. And so there's a QR code here, which you can use, but we can also drop this link into the chat. I can drop it into the chat after I do the demo, but others can follow along, or maybe one of the session supporters can drop this QR code or link into the chat. And what we're going to do is just walk through what it looks like to fill out this storytelling tool. I can talk about it or we can just do it, right? And so I'll show you, this is a couple screenshots of it, but basically you'll have a chance to either enter in your story by writing it out. There's also an option that you can enter your story through voice recording. And then there's another option that you can add a photograph if you want, that really kind of goes in line with things like photo voice, and it's ways for people to add imagery if they choose to symbolize their story. And this can be done on your phone, on mobile, or on your desktop. So we tested in both. There's an English version. You can also do the drop-down menu to take it in Spanish if you desire that. So let me go ahead and X out of this deck briefly. And pull up the new. All right, hopefully everyone can see this. Okay, you should be looking at the entrance page. Again, you can go ahead and change this to Spanish if you prefer that. But it's the same flow regardless of which one you choose, which language you choose. So in the very beginning, there's a little bit about this project and how it works, informed consent. So, you know, what you're signing up for. I will say, so in addition to the informed consent to enter the site, none of the data saves until the very end, which I know can be difficult. I think sometimes when you think about people in research are like, oh, we lost data if they didn't make it to the end. But I actually, it was really important to us that consent was continuous so that even in this very simple format, and we wanted to make this as accessible as possible in a fairly approachable design, that, you know, if you got halfway through it and you were like, you know what, I changed my mind, even though I consented in the beginning, I changed my mind, I don't really want to have this submitted and saved anywhere, then you can X out of the window and it won't be saved, which might be a little bit of a bummer if you know, you don't want, but I would say if we get about halfway through, you still want to finish it, keep it open, and then it will save once you submit at the end. All right, so as I mentioned, that takes you to the first part, and this is really just the story or the narrative part, and I'll just do a sample, but. All right, and you can make this as specific or general as you want, but the prompt really is what's a specific story that stands out in your experience as a caregiver and what that role means to you. And I'm just going to put this in right now. And then again, if you don't want to write it, you can voice record it, but I'll skip that for right now. Okay. And then an optional thing is you can you can upload a photo of that moment. And again, we want to make sure that you respect the privacy of any individuals and protect that if you choose to upload. So it could be something like in other photo-based research I've done, sometimes it's as simple as like a storefront or a stop sign, right? But it's more about the interpretation of what that place and space means to you. Okay. And then you can designate sort of what are the most important parts of your story through hashtags. So it could be, right, or promotora, CHW, that sort of thing. But you can designate any anything you like that you think would be almost like keywords for your story. And then you can talk about when the events happened for you. Was it something that someone told you about? And this is also because we know that it's difficult for caregivers. We're so busy to share their stories, and so we wanted to offer obviously direct caregivers directly to tell their story, but then maybe if someone's recording it for somebody else, or if it was more like a general story they read about or heard about. Okay. And this is the part that's maybe the newest or different for people. So remember the anecdote circle I shared where caregivers share their stories and we identified key themes, right? And so it's through these themes that we made things called triads, basically triangles that had different labels. And it's not about one being correct or the other. It's almost about saying, well, in that story, this is how I'm telling you, you have to kind of what glasses to wear, right? As you look through this story, I'm telling you how to interpret it. And this is something very simple, more just as an example of how someone spent their time the other day. But in the anecdote circle, this triad around respect versus empowerment versus being valued came up, right? And so you can drag and drop and say, you can move this little shape around to a place where you think, you know what, in my story was actually was you know, it was about all of these, or it really was about feeling respected or disrespected, right? And so you can move that to a place that feels right for you. There's always a not applicable. And one of the things we look for over time is if we start seeing a lot of not applicables, then we can adjust these stories, right? This was a starting place based on the anecdote circle and the caregivers themes there, but part of the what's neat or cool about this tool is that it's adaptive over time. You're not waiting for one long data collection and one long research project, and then that's your advocacy plan for the next 3 years. This is about constantly looking at things as they come in. What's the new ideas or the new issues that caregivers are facing, and being responsive to that and being really iterative. Okay, and then you have a couple more questions. I'm going to move fairly quickly at this point, but take your time, please, and in a way that makes sense to you, quickly or slowly, as you think about this. In my story, I felt a fear of getting in trouble, making the wrong decisions, or a fear of the unknown. So there's a couple more triads like this, and having the triangle in multiple kind of ways you can move around versus something like 5 multiple choices allows for just a lot more options of how someone's interpreting their story. And again, there's less, in some ways this could be harder or take a little bit more time because I don't know about you all, but sometimes when I take surveys, I'm like, it's almost so familiar to me. I can go very fast through a survey. Like I can go all the way down the middle or all the way down one side. And in some ways, this is a little bit of a slower process than that. But the idea is that you can really reflect as you go along and still be part of that interpretation process. And even as you do this slowly, most people, it still takes them, no more than 20 minutes. And then this is something that's more of a continuous line, similar idea, but you can kind of share, how you interpret your own story. And then we just have a couple quick follow-up questions, like, one thing I would have changed as a caregiver is, the amount of reimbursement I got or something like that. Hopes, hindrances, anything that was an asset or a barrier, hopes and hindrances in your story. We're going to dive into this a little bit more in the results, but as a caregiver, how are you cared for? I'm purposely not going to share what the result was because there was a big theme that came out here so far in this particular question. And then what was sort of the emotional reaction you had about your story that you just shared? How common do you think that is amongst caregivers? And then you can pick up to 3 emotions that you would attach to your story, not what somebody else, some outsider would feel in reading your story, but just what does it mean to you, right? And then just pick 3 for now. And then how long will the story stay with you, you think? And then Is there anyone in particular that you feel really ought to hear this story, right? Right. And then at the very end, there's some demographic questions. This is we want to understand any subgroups, or if there's differences across age groups, and go through all of the options. You can add additional options as you would like. Okay, race and ethnicity, zip code. And then if you have a particular caregiver type that you identify with, and you can check all that apply. Again, we did have people who were both family caregivers as well as caregivers in their more formal roles. Okay. And then this is something that's also important is as default, the stories are anonymous. So they're part of this bank and of research like caregiver led research and story bank, but they're all default anonymous. However, some people do want to be attributed, right? And so you can say if you want your name associated with your own quote, or you can, have something a little bit more general, like a formal caregiver in California or something like that. And then, if you want to stay in touch with us and up to date on the project does have a website through HealthLead's website where we plan to share updates from the findings. And that way, again, keeping the specific subgroup, the specific need of caregivers who don't have time to go to the meetings. How can they both give their stories? How can they interpret their own stories and lead on advocacy? And also, how can we be accountable to them as we report back on actions without having them attend meetings? And so that was really important for us to offer as well as a way of communicating. And then you can hit submit. Once you hit submit, that will save the whole response. Okay, so with that, I'm going to go back to the rest of the deck because I'd love to share a little bit about what we learned. Okay, so that was a little bit of a walkthrough of hopefully what seemed fairly simple and straightforward to doing SenseMaker. We also created a tutorial video that's on our website, and that has a visual walkthrough as well, sort of what I did along with kind of the overarching need for this type of thing. And that's available in English and Spanish. So what have we learned so far, and what do we need to learn more about? So this is a little bit of a breakdown of some of the caregivers who have shared their stories with us so far. Pretty wide range of ages, and it's actually been mostly informal caregivers, so a lot of family caregivers sharing their story, and then some formal and some who I identified as both. In terms of race and ethnicity, we have had predominantly Black and Latinx folks answer, and then some white and Asian caregivers. There were more, as you saw in my walkthrough, a lot more race and ethnicity and gender options, but so I'm reporting on amongst the responses, right? So amongst the responses, so we've got what was the breakdown. And then geography, this was really neat for us to see. We had representation across a wide variety of states. I didn't get into the specific zip codes here, but there are some very rural areas, some suburban areas, and some urban areas represented as well. And this was really exciting to see because there were stories submitted from places where even, HealthLeads in our network over many decades of working is very strong and some not as strong. And so that was also part of the heart of this project, was how do we hear from the people that we don't often hear from? And that was great to see some stories submitted across the country. This is one example of a story with the attribution that they chose. And so I'll read it out loud briefly for everyone. I don't remember life without being a caregiver. Being a caregiver is to be loving, patient, selfless, and to be willing to make sacrifices. Becoming a caregiver at a young age due to my father's poor health has shaped me to be who I am today. I received a phone call when I was a junior in college that my dad was having to start dialysis. And the very next morning, I was back home at my parents' house, ready to take care of my dad full time. I didn't even have to think twice about it. I knew school would be there, but feared how long my father had to be here with us. I did in-home dialysis treatments for him, peritoneal dialysis for him every single day for 3 years. They were 8 to 9 hour long treatments. I sacrificed everything at the time, but would do it all over again. I focused on getting him a kidney transplant with a particular area, which was a 2 hour drive, and we were given a minimum of 5 years for the wait list. Thankfully, he only had to wait 3 years and received a kidney in January of 2014. Being a caregiver has molded me to be resilient, patient, hopeful in the most difficult situations, and has taught me to advocate for anyone and everyone. So this is just one example. They're very diverse and different, not only in content, but in style, however someone wants to share their story, level of detail, or just, the way that when you hear lots of amazing stories and storytellers, there are very different voices that you can hear across the styles. And then this is a quick snapshot, not of all of the results, but just again, as I was doing the walkthrough, you saw some of the lines or the triads and where there's some clusters developing. And this is something that we'll look at periodically over time. So again, it's not to say, oh, these are the findings and now we're done and now here's the strategy and that's it, right? But it's about constantly monitoring changes. And there's a couple more complex things you can do with the data analysis that I won't have time to get into today, but this is just like a quick snapshot of some easy ways to think about it. And in the tool, what you can do is that as you highlight, let's say you only wanted to look at stories that are values coded by the caregivers themselves, then it will let you filter and just look at the stories that caregivers tagged or interpreted as being about or guided by values versus habit, let's say, and you can filter that way. And the data dashboard will basically adjust. So one of the things I wanted to open into discussion, hopefully with all of you, were some of the emerging findings. So if you remember that one question, how are you cared for as a caregiver? There were it was an open text question. You can answer it however you wish or desired. And one of the things that started to really jump out right away was predominantly all of the answers were about self-care. There were a few, I'll just say, that talked about family and friends providing support directly to the caregiver. So I am supported by a partner, a family member, friends really help me with X. And there were like one or just a few that talked about specific organizations that support caregivers. But predominantly people talked about self-care, right? And we know from earlier sessions today how important self-care is, but it was sort of interesting because the question was not a self-care question. The question was just, how are you cared for, right? In general, as a caregiver. And not only was it mostly about self-care, automatically interpreted as self-care, but it was also about, oh, self-care, but I don't do a very good job of it, right? So it was almost like self-judgment of self-care, or sometimes it was like very specific to these are the things I do for self-care, right? And so it was just interesting that everything leaned heavily towards self-care, whether positive or negative, and that it was evident that there were very few structures or infrastructures to really support caregivers. And so these are some specific examples, again, based on people as they wanted to be credited. And so, there's some examples where parents or other family members provided support, but also NAMI was one organization that offers some support for caregivers. And then again, as I mentioned, most things were about self-care. And what happens if and when you have it and when you don't have it. Okay, so that's a little bit about our project, and I wanted to open up for questions and discussion. I'll mention briefly, and I'll drop this into the chat. The survey, or not the survey, the caregiving tool is still open if you want to contribute your story. And again, because we formatted it for people who may not be able to join the Caregiver Summit. Maybe you're watching this on recording, or maybe you know someone who wanted to be here so badly, wants their voice to be heard, and just couldn't be, right, for a whole host of reasons. And so that might be nice to share with them and have them have this opportunity to share their story and be part of the interpretation process, be part of the advocacy process, even if they weren't able to join any meetings. And then a summary of the design and beta test, or that prototype test, is currently in press with a journal called Journal of Medical Informatics Research and Human Factors. So for those that want a deep dive and read through, that'll be coming out in that journal soon. So let me stop sharing my screen so I can see everyone, and would love to open the floor. I'll also have a chance to catch up with the chat since I know I wasn't able to do that earlier. Okay, so I see one question right away from Beth Connor. Love the question. It's something we've been talking about deeply for a while now. And I would love suggestions too from this group. And so this is, I don't know, this is my favorite part of presentations, is having the group discussion afterward. But yes, so what are some, so Beth asks, you might have touched on this already, but curious about what the ideas, plans are for getting these stories out to a wider audience. And so truly we do need everyone's help. What we have done so far is put it in our different network newsletters, or maybe our partners have amplified it through their channels as well. But there's nothing like word of mouth from trusted people from within a community, right? And so that's a big part of this. I will say one part that's been challenging, right? And this was kind of like challenging in a good way, because you take on something that hasn't been taken on, and that's hard, right? Is that we went national with this, right? We went national in this caregiving tool, and that means, which is great, because that way you can hear from a lot of pockets of places that maybe you don't hear from if you picked only 2 sites or something like that. And having been part of a very deep county neighborhood place-based nonprofit prior to working in national nonprofits, it's a little bit of a different game, right? Because when I worked in like neighborhood, city, place-based nonprofits, I kind of, not that I knew everyone, but it felt like I did a little bit, or if I didn't know that somebody, like they knew everybody. And so we got the word out very quickly through a lot of resident groups, groups that were meeting weekly at parks or things like that. And it's harder when you pick the whole nation, and so that's a long-winded answer, Beth, but I mean, I would appreciate any additional ideas or brainstorm that the group has for how to get this out to a wider audience, especially given the ground, literally and metaphorically, that we have to cover. Yeah, so I'll pause there. And Beth, I don't know if you want to come off mute with any ideas or place them in the chat, but I really appreciate that question.
Sheena, I have a question for you. I'm curious, were there any trends of folks mostly writing their stories or submitting pictures or audio? Did you all recognize any patterns in submissions?
Yes, that's a great question, Steph. So most of them have been written, right? But I have seen a handful that had a photo accompanying the writing. And I don't know, I'll have to check. I don't know if there are any, but if there are, it's a small amount that's been on voice recording. There might be. I'll have to double check exact like numbers on that. But predominantly it's been mostly written text, and then a small percentage of that had an accompanied photo. And so that might change, right, as we gather more. It's hard to say right now a little bit with the size that we have. Yeah, great question. And we wanted to give all the options basically, right, of different ways that felt both accessible and also just felt right, for whoever the caregiver was. Okay, and I'm gonna keep reading the chat. I know I missed a few, but maybe I'll go backwards. I have a comment from Jen. cool survey as a caregiver of a 96-year-old while I'm in my 30s caring for my own children. The story about the man who cared for his father on dialysis and how strong and resilient it made them was so well done. This type of survey can be used in the program that I oversee. Great job. That's great. It's great to hear that this is applicable. And, one thing I'll share is this is a story about how we adapted and went through a whole process with caregivers for caregivers, right? Nothing about us without us, with and by and for caregivers. But the base kind of this tool has been used in a lot of different settings, from international NGOs looking at different issues to like super neighborhood based youth and like neighborhood activism oriented groups. So it can really range, and it's been used in a lot of different countries. Not this exact version, it's almost like the base platform, and then each group customizes it to their own needs. So there's some great other cool options. I'm happy to hang out and share those stories too that we got to learn about as we were learning how to customize this tool. Megan asks, sorry if I missed this, will you be able to identify patterns of experience across demographics? For instance, if caregivers from rural areas tend to be reporting similar experiences, and how policy might address those varied experiences? 100%. So that's why we ask the questions, right? And I also think like, in research in general, but also just as like, I often kind of joke that even though I have been part of a lot of different research like methods design, I I'm the person as a participant that like will X out of a window real fast. Like I don't want to fill the thing out. Maybe that's good insight, right? Because I'm just like, oh, this is so long. Like I don't want to do this, or like I have other things to do. And because of that, for better or for worse, and I still want my voice to be heard, right? So there's no part of this that's apathy. It's just like I got a lot going on. I can't be answering 20 pages of anything, right? And so I feel like as a design principle, never ask anything you don't, if you're not going to do anything about it, right? And so the reason we ask the demographic questions, the reason for the zip code, or just being able to suss out kind of rural versus urban areas, or even just different states and cities in terms of different policies, is so that we have that opportunity to see if the patterns of experience and the themes are different across demographics. Are they different for older caregivers versus younger caregivers, for different across gender, across caregiver types? And so all of that allows us to do kind of exactly that kind of comparison or deeper analysis that you mentioned, Megan. So that's a great question and comment. And then I'm scrolling up. Dawn Eve. You shared, please feel free to come off of mute too, but I know sometimes when you put something in the chat, you're also, it's not so quick and easy to come off of mute, but I don't want to prohibit anyone from doing that as well. But Dawn Eve shared, very cool. You could simulate the triangle with 3 sliders, measuring the 3 dimensions, thinking of ways it might be easy to use common survey tools to replicate this really interesting approach. Yes, and so I think that's exactly what we wanted to get after. And people are like, why triangles versus, I don't know, some other sort of shape, right? But it's really just, this idea that there's I don't know about you all, but sometimes like you can kind of tell in surveys if there's like only a certain number of questions. I can kind of tell like what they want me to answer. Like, or I go too fast. And there is something about the complexity of having sliders, or like having so many different options across the 3 points, that slows ourselves down in a good way, right? Not slows in a like a barrier way, but slows in enough to take the time to really like think about our own stories, right? And to say like, this is, maybe here, maybe there, right? Like this is how I would interpret my own story. So yeah, it would be interesting to think about how that could be translated, maybe not even in this specific project, but in just other ways of developing survey tools. Great point. Oh, I love that, Beth. It would be interesting to see the various submissions become a larger visual artwork piece. Oh my goodness. Yes, that would be so neat. And, I think there is, I shared just some quick snapshots of what the clusters across like a few of the triads look like, but there's actually a lot of other data visualization that can be possible. And so that combined with almost like the photos that people are sharing, and the words themselves, right, as like text visuals, that'd be really powerful. Yeah. And again, it's because, you know, um, I know I'm coming at this as a researcher, so I love what stories data can tell. But for me, the heart of this is like, because it's in their own, not only in their own words, caregivers in their own words, but it's they are the interpreters. They are the guides along the way for us, right? No one is um reading a story and saying, okay, well, this is what that sounds like to me, and this is the narrative now that's the dominant narrative, right? In a campaign. It's always just you all, right, as caregivers, it's like, what's your story and how do you want others to truly hear your voice in it, right? So I love that idea, Beth. Yeah, lots of great riffing and ideation already in the chat. Then I saw the addition from Megan. My program created the caregiver tool for tracking home health experiences, and we are currently focus grouping to figure out how to streamline it while still getting the info that will be useful and potentially powerful. Great, that sounds great, and would love to learn and hear more about it if you feel comfortable coming off of mute.
Hi, this is Megan. Sorry, I actually happen to be sick and I don't have much of a voice today, so not ideal. But yeah, I work for a program in Pennsylvania. I am the mom of a very medically complex little guy who relies on home health nursing. But I also now currently work for a program called the PA Technology Assisted Children's Home Program that supports families in multiple counties in Pennsylvania who have medically complex kids navigating systems of care. And one of the amazing public health nurses that I work with had a brainchild of an app that could help families streamline and keep all of their data in one place that's in their hand all the time on their phone or on a device. It's called Shift Check for caregivers. And ideally, it's a tool that allows families to basically log and track their home health care experience, particularly when they're utilizing multiple home health agencies or something along those lines. But additionally, to track the impact of when shifts aren't covered. So it gives families a space or caregivers a space where they can keep track of a roster of nurses, identify hours that were not covered, and then sort of report out to themselves and to the powers that be that meant that child didn't get to go to school, or the caregiver missed work, or a sibling missed a doctor's appointment, whatever those, what one of the previous presentations kind of called the domino effect. And then what we hope to do, and this is only in PA right now, but what we hope to do is to be able to depersonalize that data and show, the systems of care, what the impact is, what the financial impact is, what the familial impact is, et cetera. So it's a very tiny little program right now. It's an app. But yeah, I'd love to connect to talk a little bit more about it. I think it's so cool that so many of us across the country are sort of zeroing in on this need and then sort of seeing where it goes.
Thank you so much for sharing, and especially I know as you're trying to rest your voice as much as possible. So I really appreciate that and would love to continue the conversation. Certainly, yeah. I think there's so much opportunity for innovation. Not just like I'm a strong believer no innovation for innovation's sake, right? But if there's ways we can bring new options and new opportunities that are not being addressed right now, right? And to respond to people who are facing a challenge, like how do you hear from the people you're not hearing from? How do you make time for people who have no time? Right, like these are simple but pretty deep and profound questions that need all of us, right, to try to do different and test new ways out. And I just love hearing about other people work in other programs and other organizations also doing that. So thank you so much for sharing. Yeah. You know, one story I wanted to share briefly in that the beta test findings, and I thought this was really important. And as I mentioned, the aspect of having agency, power in the time that you tell your story, the way that you tell it, being able to do that, you know, literally what time of day you prefer and for however long you prefer was so important. And here's like a very specific way that that played out. So as I mentioned, we asked people, oh, okay, you know, we thought, okay, I think this takes, you know, we ran through and we're like, I think this will take between 15 to 20 minutes. So we asked people, how long did this take you, right? And they answered. And I did tell you all that the average was around 20 minutes. So we're like, okay, that's correct in terms of validating that time. Well, I also think that the qualitative sort of mixed methods researcher in me is like, the outliers are important. Don't just go with the average, right? And so there were also some people, I mean, there were some people that did it super fast, like 10 minutes, right? But then there were also some people that took an hour or an hour and a half, which, right, right away you'd be like, oh no, like that's so long, you know, compared to the 20-minute goal, right, that we had, or the average. Oh no, like an hour and a half is much longer than that average. And then we cross-check that with another question we asked, which was more just subjectively to you. Did that feel like, not what was the minutes time, but just was it too short, about right, too long, right? There's some other questions we asked. It was really interesting. And that's not to say, you know, in the test, of course, there's always going to be people that were like, it was just right. Some words said it was a little long, right? That always is going to happen. So there were some folks that said it was a little long. But what was really interesting was the people that were the outliers, the like 1 hour, the 1.5, it didn't match up with any answers that said it was too long. Some of them actually said it was fantastic. Like, I'm so glad it took an hour and a half. And so some of them said it was more like indifferent, neutral, right? Like it wasn't the best, but it wasn't noted like absolutely not too long. And the one that was like, that was great, took me an hour, or it was really interesting to dive into. And I think like what we found in that was, you know, we wanted it to be short. Again, busy caregivers, certainly it's still more time manageable maybe than committing to like a year's worth of meetings or things like that. But for the people that said it took a long time, it was really interesting. In some cases, it took that long, not because it's how long it takes to click buttons and write words on a page, right? So that's not about functional time, but they shared like, it took me that long because what I was sharing was really heavy. It brought me into a reflective space. I had to take pauses, right, to take care of myself. So I'd like sort of stop the process and like, you know, take time for myself and process, right? That anyone who's processed or thought back on a heavy experience knows that feeling. And so it took longer because they were taking time to process something that was really heavy and emotional. And there was power in that, right? Not rushing through it. And then for someone who maybe was thinking about a really like empowering experience, it took that long because they were thinking about their incredible life horizons, and sort of similarly were processing and taking the time to like really journey through that, right? And so I guess I wanted to share that because for me, the most important thing about time for busy caregivers is choice and power. And you know, it's not for me to be like, what's good time is this time of day, and what's good time is exactly 20 minutes, right? So if an hour works for you, great. If 10 minutes works for you, great. Hopefully it's all still very, very manageable and short, right, in the grand scheme of things, and making it more accessible.